Hi.
Hello.
Hi, I'm Dawn Damari, and you're listening to and watching another episode of A Teaspoon of Healing. I am happy to introduce my guest for this episode, Fredric Schiffer, MD. He's a psychiatrist, a part time assistant professor at Harvard, a speaker, and a best selling author. Hi, Frederick.
Hi. It's a pleasure to be here. Thank you.
Oh, thank you for coming on the podcast. And do you prefer to be called Frederick or Fred, Dr.
Yeah,
Schiffer?
yeah.
I want to
Most
make sure
people
I
call
use
me
the
Fred. Yeah. Huh?
Fred? Okay,
Mhm.
well, hi, Fred. I hope you're
Yeah.
enjoying your day.
Yeah.
Um, so, yeah, would you mind telling our listeners briefly, just a brief summary
Sure.
about what you do?
Okay. I'm a psychiatrist with a clinical practice over decades, and also a researcher at McLean Hospital at Harvard, where I have come up with a novel theory of psychology that has many clinical applications. And I can explain it briefly. What I have
Sure.
discovered is that all psychiatric problems that I have ever encountered, that's the whole gamut, uh, come out of traumas. And often the traumas aren't recognized. And so the traumas don't have to be war or sexual molestation. They can be that, and they are horrible traumas. But most of the people I see in my Boston suburban practice uh, have childhood traumas from a dysfunctional family with a mother who tells her son when he's in diapers, "You'll never amount to anything. You're a failure," and or divorce or an absent parent, a bullying sibling, and then that leads to new traumas. When they go to school, they bring uh, their trauma from home, and they're kind of more introverted, and they get picked on, and that becomes a new trauma, and then they get in with a bad group, and then they get into alcohol or drugs later, and by the time they get into substances, they see that they're a substance abuser, and they forget all about the trauma. And I like to say I don't have any substance abusers, or opiate addicts, or alcoholics in my practice. I have trauma victims who turn to that, and people turn to all sorts of things to deal with their traumas, and most of them are not helpful or very destructive. And and so what I found is that the trauma seems to get located in one brain hemisphere. And it turns out that each brain hemisphere can support a whole mind. And you can remove a brain hemisphere for cancer, say, or neurosurgeons have a procedure where they put half the brain to sleep with an anesthetic agent,
Hmm.
and and uh, and the personality can change in a lot of people by putting half the brain to sleep. And so I developed a technique for stimulating one brain hemisphere or the other, and it's so simple that it's shocking. And I want you to try it if you would.
Oh,
Okay.
oh, okay.
So
And I've read a little bit online about your theories, which we'll talk about, and how to try it. I'm wondering if it's going to be the same thing. I found it really interesting. I was reading a lot about it
okay,
last night,
great.
and yeah, it's really fascinating. And I know,
So do you
as
have
we
any
had talked,
junk mail,
yeah.
Andy?
Do I have any junk mail? I
Or
do, but it's upstairs. I don't.
you
You
have
know,
a
let
credit
me.
card or an iPhone or anything?
I have an iPhone I
Okay.
can
The
use. Okay, let
iPhones
me grab it.
iPhones work great.
Oops,
Here, I'll
sorry
use
about the noise.
mine
So
and I'll show
here
you
it
what to do.
is.
Okay.
Okay,
You
I've got
cover
my phone here. Here we go.
cover your right eye like
My right
this.
eye. Let me. Okay,
Okay.
it's okay to have. I have my glasses on.
And then yeah, keep your glasses on, and then move it over to cover half your left eye. So you're looking out the left half of your left eye.
Right.
Okay.
Yeah.
And it turns out that we have an fMRI study that shows that this actually activates your right brain.
Yes.
Okay.
Yes. I was reading about this last night. And now,
Okay.
do you have to cover the bottom part too,
No,
or is that coming
no,
next?
no,
Okay.
you don't have to. This is all you have to do, and people can try
Okay.
it at home if they want. And so what I would ask you to do is to maybe think of something that's somewhat upsetting.
Okay,
I don't
let me
want
think.
to traumatize you. Uh,
No, no,
but,
let me think, 'cause I'm
but
in a good mood, so I can certainly think of something. Well, there's a lot going on, so sure.
okay, and then
Take yeah.
uh, and this occurs within seconds, and so I want you to evaluate how much distress you feel, or whatever you want to measure, anxiety or whatever, from 0 to 10, and uh, and do you have that?
Yes, I do.
Okay, so now I want you to do the opposite. So we're going to cover the left eye and
Okay,
move
let's
it over. Now,
see.
a lot of people look out the whole eye, and that doesn't work because it goes to both hemispheres. But if you move it
Okay.
over, so you're looking at the lateral half of one eye. Now
Okay,
we're
so the
looking at
left
the it's called the right lateral visual field,
right.
and now I want you to think about the same incident, or the same whatever you found problematic, and and rate from 0 to 10 how much distress you feel.
Okay, I did.
Okay, and so you put it down. So that's it. So was there any difference between one
There
side of
was. There was.
how many points was the difference?
Well, the point was about 3. I know from this side, which is probably the right side of the brain, thing is, it was still a really traumatic thing I was thinking about, but it was worse from this side than
Uh-huh.
this one. So this side, it was about, and I tried to get it lower just because I felt like, gosh, am I insensitive? But I would say it was a 5 to 6, and here I would definitely say it was an 8 from
Uh-huh.
this side.
Okay.
And so is that so this side, which is my right,
Yeah, it
is
correlates with your
activates
left brain. Yeah.
the left brain. So it seems like for me, the left brain, and I tried this last night as well,
Yeah. Okay.
and I
Did
did the
you get
same
the
thing, and
same
the left
result
brain
last
made
night?
me more upset, whereas when I shut off this eye and then I looked out of, my left eye, which is the right side of the brain, it felt more, I don't know if that's the logical side of the brain. I don't know. I did
Well,
not
it
get as
doesn't
I
have
did
to
not get
do
as
with
upset.
that. In other words,
Okay.
that the left brain may be more logical and the right brain may
Than
be
some
more
people.
poetic,
Oh.
but
Oh,
also
okay.
the left brain controls the right arm. Okay, so there are a lot of so we're
That's right.
looking at another function, and this
Okay,
is
so this
personality.
arm here is controlled by the left brain. Okay, so but each brain can be logical.
And what we're doing is we're looking at something different, just like a hand movement is different from speech, or it's different from emotional feelings. That this is a
Okay.
different thing. This is personality, and that on one side
Okay.
there's more of a troubled personality that's more childlike.
Oh, okay. So
And,
for me, that's definitely the left side then. It must be because I tried it again. I tried it also last night because I had read about
yeah,
this your theory, which is really interesting, and it did the same thing. It was a different. I thought of a different
yeah.
traumatic event or memory, and yeah, for the when I was looking at it this eye, so this side of the brain, the right side, I did not feel as upset. So both times. So says, what does that? Is that something within
So it's
my personal
showing,
trauma?
or
It was the same as today.
it
Yeah, it's
was
the
the same
same
as
as today. Different event.
that.
But yeah, so I noticed that
Right,
my
right. So
yeah,
so
when the right side is different than the left. Less
right,
this side seemed less upset than when I was looking at it this eye, which is this side of the brain. The
right,
left got more upset both times.
right. So,
Very different.
so now everybody thinks that the left brain is your happy brain and your right brain is your depressed brain, but
Oh,
but
okay.
but that's
Maybe
not.
it's not.
I find that not to be true,
It's not from
and that
others.
in your case and in many people's case, the left brain it carries the trauma,
Okay.
and what when I say that, what I mean is that when you look out your right visual field and stimulate your left brain, it's more like the little girl inside you is looking
Oh,
at the world through her trauma. So it's all kind of, oh my God,
mm-hmm.
the bad things are going to happen. And out the other side, it's more realistic or more adult like. And yeah, I
Yes.
can handle that. That might be a problem, but I'll deal with it, and and uh,
Yes.
and this then becomes the basis of what I call dual brain psychology.
Okay.
If I promote my book here,
Yes, that'd be great.
it's called "Goodbye Anxiety, Depression, Addiction, and PTSD: The Life Changing Science of Dual Brain Psychology," and it's on
Oh.
Amazon.
Oh, it is? Oh, cool.
And it's a fun read. It's not a heavy read, but it's substantive. It's not a just a scratch your elbow and you'll feel better. It's kind of a it goes really it's really interesting about how the mind works actually, and how trauma affects us and causes these problems, and then it leads to solutions. And for instance, if someday you happen to be in a depressed mood, or feeling anxious, or you're having trouble because things are piling up, you can take your iPhone now and look out your left half of your left eye, and within a few seconds you'll feel better, and it's like your whole view of the world has changed. And as soon as you can say, "No, I can handle this," that changes everything, and it gives you a feedback that then changes, and it can stop the anxiety right in its tracks.
Wow, that's incredible. So if I'm in a situation where I'm feeling anxious about something, I can cover so for me, it's gonna be different for anyone listening, it's gonna
That's
be
right,
probably different for them.
and they can figure out which side is their better side.
So for
Right,
me, it'll be I'd cover with an iPhone or a piece of, like you said, junk mail or
right.
anything, cover up,
And we have sunglasses that
this
we're going to market
Oh, okay.
that you can wear. They look nice, and unfortunately, I don't have them with me here. And they'll do the same kind of stimulation. And the advantage is that you can actually wear them for a period of time.
Oh, okay, and so then now when you do it, you have to so you cover right eye and then part of the left eye
Yeah,
or vice
yeah.
versa. So,
And
okay.
the reason is that each eye goes to both hemispheres.
Right.
And if you look out the left side, it's stronger. It's divided 60-40, and that's
Oh,
why. But if someone has a problem in one eye, I can have them look out. I close this eye and look out here and then here, and they'll feel differently. It's really interesting.
oh.
Yeah,
So, yeah, so even if someone has poor vision in one of the eyes,
yeah.
for some reason, this would still work?
It still works, yeah, yeah.
Oh, okay, that's really incredible.
And then we have an LED that we put on the forehead. If I have it here, um, so this is an LED that we put on the forehead, and we
Oh,
have
cool.
a $2.5 million grant from NIH,
Oh,
which
nice.
we're now completing the study, and we're treating fentanyl addiction. Most of the
Oh, okay.
participants had like 3 overdoses
Oh,
before they
no.
came in, and they're most of them are doing really well, and we think the people who aren't doing well are getting the sham treatment. Now we don't know that.
Oh, I see.
We're
So there's
still
a
going.
control in there. There's like a placebo or
It's
a
a
control
placebo.
in
It's a
there?
double-blind placebo
Oh, oh,
control,
great.
and it's for the
Wow, that's really
FDA.
exciting.
It's and we have a breakthrough designation. So we've got serious science with this, and we have about 25 papers published on different experiments at Harvard that we've done to support it.
Well, that's wonderful. This is
Yeah,
really, really,
yeah,
really exciting. There's a lot of people I know listening that are either very interested in
yeah.
psychology, like I am, and then I have, like I had mentioned before, we had talked. I have a family member who works in this field, so
Right.
I'm sure they'll find it interesting. This is really interesting.
Yeah.
Now, so when I was reading about your work and your bio, and just speaking to you today,
Mhm.
depression and anxiety,
Mhm.
there's a big relationship between those things
Mhm.
and past traumas. And I'm assuming addiction too,
Yeah.
but I guess mainly like first we talk about depression and anxiety.
Mhm.
So the link is really with the past traumas. Now, either childhood or
Yeah.
just in your past.
Yeah, now it could be if someone's living in Gaza, uh, or
Yes.
or uh, or Ukraine,
Yeah.
they wouldn't be normal if they weren't depressed.
Of
Okay,
course. Of
so
course.
what I deal with as a psychiatrist is old traumas where the person doesn't realize that they're not in Vietnam anymore,
Okay.
and so it's a different thing. If I were trying to get somebody to cope with being bombed, that's a harder
Yeah.
task, you know.
Yeah. Yeah. It's definitely impossible not to feel depressed or
Yeah,
anxious all the
exactly.
time.
And so depression is actually a normal feeling. It's just
Okay.
that the trauma gives a perception that is skewed in a negative direction.
Oh, okay. So a lot of times, like you were saying, for example, the Vietnam veteran
Mhm.
who is not aware, well, he's aware, he or she, they're aware that they're no longer there, but maybe in their mind, they still think that they're there.
Right.
They can't really get past because it's so traumatic.
Yeah,
So that could probably
and
be
even
applied to a lot of people.
with you, that what I do in my therapy is I have a person put on the glasses, and I talk to each side, and then we would find out what that side was really upset about, and then I try and get the healthy side to be like a co-therapist and help that troubled side, because left alone they try and sabotage each other and dominate each other,
Oh,
and find so some people are so dominated by a troubled side that they just wind up drinking and using fentanyl and have a failed life.
I see. So even if you're really consciously trying to think of it through a different side, so I guess one side can be more dominant,
Yeah.
and if you have had the trauma, it seems like whatever side has the trauma seems to take over.
Uh, I would say generally that's true,
Okay.
and the focus of psychotherapy is to get the healthy side to dominate, and to
Yes.
be a good parent, and not to just try and beat or kill, the troubled side.
True. Yes. So I see. So a lot of so the depression and anxiety, and so when you mentioned addiction, sometimes
Mhm.
addiction, of course, I mean, of course, I don't have any background in psychiatry or psychology, so correct me if I'm wrong. So if, sometimes the addiction is to cover up some of these feelings or just to
I think
numb
it
or
always
oneself.
is. It's just that
Yeah.
people don't realize the connection with the trauma, and they often don't want to know it.
Hmm.
That there's often a resistance to seeing the connection with the trauma, and but I find that I have never seen a patient who had an addiction that wasn't related to the trauma. And with the light, what we do, and in this fentanyl study, if we put the light on the positive hemisphere, it
Okay.
enhances, it activates the positive hemisphere, and the
Oh,
cravings go away.
wow.
Or,
Now, so the light, it's coming, so it comes, you don't have to look at, well, I'm assuming you're not
no, it's
looking at the
not
light.
through
So it
the
just
eye.
shines within,
It goes
actually through
through
the
the
skin.
skull into the brain,
Oh,
and the
wow.
FDA has determined that it has no significant risk, and
Wonderful. Okay.
it's called photobiomodulation, which is
Okay.
a burgeoning field in science today, and it's not. There are no known risks to it.
Oh, okay. Yeah, just
The
I guess as long as
dr-
you're
the
not shining it into your eye, then that would probably that would probably not be good. But
Now,
if you're
actually, you can't put
okay, is that okay?
if you put a laser in your eye, you'll destroy it.
Yes,
But
yes.
this is an LED,
So it's okay.
and it's actually used for the treatment of certain eye diseases. I'm
Okay.
not recommending that anybody, stare at it, but we don't have to wear special goggles or anything in the treatment.
Oh, so it can really penetrate through the skin and the skull,
It does.
and get into the brain.
Yeah,
That is amazing.
yeah,
That's really amazing,
yeah.
and it can help stimulate. So is it so it's stimulating the healthy side, whichever side that is for
Right,
that person.
and then I have a new model that inhibits the other side by
Oh,
pulsing very slowly, once a second, and that's to inhibit the negative side. So we're stimulating one side and inhibiting the other with the light, and that we find is much more powerful an intervention.
Okay. Oh,
so we have to go through the FDA and all that,
yeah. Well, that's okay. That's good. That's the nature of studies, but this is really fascinating. So, for some people, so I guess what I'm trying to figure out. So, you said, for example, for me, the left side of the brain seems to be the one where the trauma is,
right.
and for some, it's the right. So, yeah, how does that work? How does it get stored in one side of the brain or the other?
Well, we don't really know, but I
Mhm.
suspect that um, that it's the type of trauma and the timing of the trauma that
Okay.
determines it in development.
Okay.
But it tends to be a trait that stays with you. And Sometimes I have patients who flip, and I don't know what that means.
Oh,
But basically, usually, if somebody's like my right side is my negative side, and
oh, okay.
um, and it's always been,
Okay.
and for most people, it stays on one side.
Okay. And is there a ratio of people is it that have it on the right? Is it usually more prominent to have
I
the
think,
negative side
yeah,
on the right or the
yeah,
left?
it's a good question. I think that there's probably in different studies we get different percentages,
Okay.
and I'm not sure if it's why that is. It could be that there's some meaning to that, uh, but generally, I think more people have their trauma in their um, right side, but that would be like 45% to 55%. So it's not
Okay.
that everybody has a negative right hemisphere like most scientists believe.
Oh, okay. Yeah, and that's interesting what you had said. So most scientists do believe that most people of the negative side is on the right,
Yeah.
rather than the left.
And,
Okay, that's
and that
really
really
interesting.
comes from studies that were done that showed that there were EEG changes with depression that were on the right side, but they used average data. They didn't look at individual data. And again, if you average everything with even with my stuff, if it's 45 to 55, I would come out saying all the bad stuff's in the right brain. But what I see is that in an individual person like you, it's often the left brain that's
Mhm.
carrying the problem.
Okay. And I'm curious why. Is there a reason why? I wonder, does it trace back to a certain age? Because I know the left brain, okay, just growing up, I always thought that the left brain was tied to creativity and being art and art
It's
or
sort of the other way
emotions, and the right
around.
was logic. Oh, it is
Yeah, yeah,
actually.
it's the right
Oh,
brain
okay.
that's supposed to be
So
more
the right brain is more, I
artistic.
guess, so
So it's supposed to,
artistic and
yeah.
oh, well,
But,
that's great. That's good for know for
this
me.
is different. Um, that if I had you look out one side or the other, you wouldn't feel more logical
Oh,
on your troubled side, even though it's your left brain.
okay.
So I think that it would probably be if you had just a logic test, your left brain would do better. We're dealing with something different,
Right.
and
Right.
and uh, and also no matter which side you're looking at, you can move both sides of your body. You can move both
Right.
hands, and you can speak.
Yes.
So it's not like you're only using one brain, but that there's a personality that we're evoking with either the visual technique or more powerfully with the LED that changes personality.
Wow. That's really incredible. So if somebody has, for example, anxiety and they go through, I guess the test with the phone or the junk mail,
Yeah.
or even further with the LED.
Yeah.
So how does that change, I guess them in their day-to-day life when they're not actually receiving the therapy?
Well, um, first they should buy my book because it really gives a lot more information about this. Uh, uh, but uh, I teach people how to talk to their troubled side,
Oh, okay.
and how to form a relationship with it. It's really like two different people, and you have to get to know it. And I have a nice relationship with Freddie now. You know, for a while, you know, he was causing me difficulties, uh, uh, but and what I do when I work with him, I'll look out his side. Actually, he's over here. No, I'm backwards. I'm getting mixed up.
It gets confusing.
Yeah, but and I can talk with him, and I can feel him, and I have a conversation with him. And whether people are going to be able to do that on their own, I'm not sure. But that's what I
Interesting.
do,
Oh.
and it's what I do in the therapy.
Oh, so you're able to talk to maybe because you had said Freddie, was that
Yeah,
maybe the childhood version
yeah,
of you?
yeah,
That's really interesting. And so
yeah,
you can do that and kind of calm down your inner child, I guess, is what
yeah,
kind of people call it,
yeah.
through that, through
And
your
talk to
brain.
it, and let it know. You know, it really wasn't your fault. You were dealing with trauma,
Yeah.
so it interfered with your functioning.
This is really interesting. And so you also deal with, like you said, with addiction, fentanyl, and also gambling addiction.
Yeah.
So what have you seen? What results have you seen working with these therapies with people that have these addictions?
Well, I have an interesting story. Now, I don't see a lot of gambling addiction, but this one patient who was coming in for an opioid addiction, he was doing very well, uh,
Mhm.
told me he was gambling. So I told him, I said, well, you're in luck. I happen to have a casino in the back. I said, but unfortunately, there's a cover charge. And so we had an auction, and I got him up to $2,000 to pay to go into my casino in the back.
Oh, wow.
This is unaided, you know.
Right.
And then I had him block his eyes, and and uh, and he wouldn't pay me anything.
Interesting. Oh, okay. So you realized he was able to see it from
On the
the healthy
mature
side, or I
side,
guess the
yeah,
correct side,
and
the
we were
mature
able
side, and
to,
said, "Oh gosh, no, we're not going
uh,
to pay this
yeah,
2,000 to
and
go
also
gamble."
his opioid addiction was on the same side.
Oh, that's interesting.
Yeah,
So both addictions,
yeah,
and
and
so
I
he was able
often
to get
look
over that.
critical or negative on their negative side.
Okay. So and that side that has the trauma is gonna be the more negative side, and the other one is going to be more
Yeah,
positive because it doesn't hasn't had the trauma.
right.
And and now so if somebody's taking either a medication or going
Mhm.
through traditional therapy, can they also use
Sure.
these therapies that you're using?
Yeah,
That's
yeah,
that's great. And yeah, and so now are there people maybe I'm not saying that there's I think most of us have some trauma
sure.
growing up, but are there some
In
people that
fact,
don't have that are pretty much like they don't have they're pretty equal on both sides
yeah,
on how they react to things?
I find that when I've tried to test neurologists, they never have a difference.
Interesting, really?
Yeah, and I think
Is
that either they're so repressed, or you know they're just healthy on both sides and don't have a difference. Uh,
Oh, okay, yeah, so it's true that some people, either they may not have had traumas or they don't remember them,
yeah, in my
very well.
practice, about 15% don't respond, but usually that's because they're more repressed, and eventually they
Oh,
will
okay.
respond.
Oh, okay. So you can really repress these traumas. That's what I've heard from speaking to other people on the show that you can, some people and some of us, we can really repress
Yeah.
these traumas. And until you have therapy or some other kind of modality to really get in there, then
Yeah,
there you realize that they're
and if you
there.
repress it, it doesn't mean that it's not affecting you. It just means
Okay.
that you block your um, awareness of it, your conscious
Oh,
awareness of it, and your acknowledgement of it.
okay. And that probably can help. When I say help, it helps people, but it's they still really need to deal with it. But that's how they cope is just kind of repressing it, avoiding it,
Yeah,
and then
yeah,
hoping it goes away. But it doesn't really go away.
no, no. Most
Okay.
of the solutions that the immature side finds are destructive.
Okay.
Occasionally, someone finds the library and as a adaptation, but that's rare.
Yeah, and Is there a way that other people was I guess they could get your book, assuming the studies are probably closed, but people can probably work with you. Do you work with people virtually or mainly in the Boston area?
I have to be licensed in this state
Yeah, I
where
figured
I
that.
am.
I don't know if you can get like I'm a dietitian. In California, there's no license, but in other states, we have to actually get licensed to practice virtually. I'm not sure how that works for
Yeah, well, I'm
psychiatrists, if
not
you can do
either.
that. Okay.
Most of my um, practice is in person, or if it's virtual with people who are in Massachusetts.
Okay. Yeah, that's what I figured. Unless you get licensed in all these states, but
And then
which is
I'm
not fun.
trying to get other clinicians to get trained
Oh.
in what I call dual brain psychotherapy,
Oh,
where I
okay.
teach them how to talk to the two sides and really
Okay.
work with that. It's a special skill you have to develop.
Oh, okay. So if you're a psychotherapist or a psychologist, I'm assuming psychiatrist as well,
Yeah,
you can go through this training and then utilize this in your practice.
yeah.
Oh, wow, that's really great. It's really breaking. It's something I had never heard until well last night, and then this week when I was reading about it, it was really fascinating.
And
And
the other thing is there's a term in science called the effect size. And what it
mhm,
means is, how effective is the treatment? So if you take, say, an herb or drink herbal tea or something, it's very hard to know, whether it actually helped or not.
mhm,
If if someone um, um, took cocaine, they would have a reaction that would have a big effect size, and
right,
so Prozac has an effect size of about zero point 0.3, which is low,
yes,
and
okay,
our study showed in a prior study that it had an effect size over placebo of 1.5, and that's twice
oh,
high. It's really
that
extremely
is high.
powerful. So
Oh, that is
that's
high.
good. Yeah,
That's great.
yeah.
And so hopefully, a lot of do you know if there's particular other psychotherapists or psychologists, psychiatrists who are trained in this that
No, I'm
or is
having
this
a hard time getting people to kind of wrap their heads around it, and
yeah,
it's a little too novel. And the
okay.
idea of the man with two minds,
Yes.
and so it sounds weird, but it's real. You
No,
know,
no, the thing is it doesn't sound weird, but I'm not, trained in this. Sometimes people who are trained in something, it runs kind of in the face of what they've been taught, right?
yeah,
So where people who are not in the field, we're sometimes can be
yeah,
a little bit
might
more
be
open
more
to it.
open to it. Yeah,
Yes, for sure.
right.
And you had mentioned at the beginning, was this kind of related to those split brain studies?
Yes.
They had a surgery that cut the connection between
Yeah,
the left and the right half of
this
their
is
brains.
how I came to this. And I was noticing early in my career that I wasn't seeing a lot of egos and ids and superegos, although I knew what they meant. But what I was seeing was that the patient would come in and be very symptomatic and immature, and then he'd become very mature and healthy, and then something would happen and he'd regress and it became like he was when he came in. And I thought it was a personality change. And
Hmm.
and then when I reread a book from college on the split brains, and and uh, and I saw that this related to what I was seeing. Now, the split brain studies are about they won the Nobel Prize. The studies,
Hmm.
and they're
I saw that.
about uh, an operation that was performed on people with intractable epilepsy, and
Okay.
the connection between the left brain and the right brain. The brain sort of looks like a walnut. It's wrinkled and has two halves and a
Hmm.
stem in between. So they cut the stem. It's called the corpus callosum. And what happens is you then have two independent people. One hand
Wow.
wants to smoke and the other hand puts the cigarettes out. And there are all these stories. It's called a
Wow.
post-combustion syndrome. And eventually the left brain takes over. But for about 2 months, they have this. And I did a study I did actually the last split brain study in California, where I put two different words on each side of the screen, on the left visual field and the right visual field. And essentially, I said, how much do you feel? And one side had the word happy, and the other side dishonest, and they were positive
Hmm.
and negative words. And and what we found was that in one patient, there were two patients. His left brain had a very negative view of himself. His right brain had a very positive view of himself, and we published that. And then the other patient had about the same view of himself on both sides. But when we were setting up the equipment, I was talking with him, and he mentioned he had been bullied as a child. And I know as a psychiatrist that that's a very traumatic experience. And I asked him if that bothered him. He said, no, it happened, so many decades ago. And so when I was testing them, I interjected um, about 10 bully questions. How much did the bullies upset you? And his right hand, they pointed to pegs from none to extreme. And so his right hand signing for his left brain, which was speaking to me and telling me that he wasn't upset by it, indicated he wasn't upset. Uh,
Okay.
his left brain, I'm sorry, ooh, I'm getting confused.
Yeah, it doesn't
His
matter.
left hand signing for his right brain, which was upset, indicated he was extremely upset. The right brain is not able to speak, but
Oh,
in split brain patients. But it could point to different pegs and give answers from none to extreme. And it indicated it was extremely upset by the bullies. And we published that. And we felt that his right brain was very upset by the bullying, even though it happened years before. His left brain was not.
so his left brain, that was the healthy, mature side, and so
Yeah.
it really was stored in that right brain, even though he didn't really remember, or he just said, "Oh, I remember," but it wasn't a big deal. So look,
Yeah,
so it sounded like maybe the the side that was more mature was more developed in him, or he had just
that's right.
repressed it.
Yeah.
Okay. Wow, this is so fascinating. I really enjoyed this discussion.
Thank you. I did
And
too.
yeah. So how can people learn more about you? And I know the book is on Amazon.
Yeah.
Are there any place that people could contact
There's a
you?
website called www.dualbrainpsychology.com, and
Okay.
that'll have a lot of information about this,
Oh, okay.
and has some papers and so that's a good place to get information.
Okay, dualbrainpsychology.com. I'll put it in the show notes as
It's
well.
one word without any hyphens or punctuation.
Oh, wonderful. Well, thank you so much again for coming on the
Yeah,
podcast.
my pleasure. Thank you.
Yeah, I really liked this discussion, and it's really interesting to me. I'm going to try that little experiment again and with another memory and see if I still get the same result. I think I will because
Yeah,
last night I did it,
try it
and
with your
today.
friends, and
Yes, I
also
will do that.
the viewers should try it and try it on their friends, and
Yes, for sure.
it's really interesting, and you don't expect it to work, and for some people it won't do anything.
Okay,
About 15%
that's right.
don't respond, but most people do,
Oh, that's
it's
interesting.
cool.
That's
Yeah,
great. Wow. Well, thank you again so much. I really enjoyed this
thank you.
discussion,
Yeah,
and I hope you have a great rest of your day.
thank you.
Hi, I'm Dawn Damari, host of a Teaspoon of Healing podcast and registered dietitian at True Harmony Nutrition. I just wanted to remind you that the opinions shared on this podcast, unless it's a solo podcast featuring just me, are the opinions of my guests. I do not necessarily share the opinions shared by my guests on the show. I also wanted to remind you that this podcast is for informational and entertainment purposes only. It does not constitute medical advice.